Hello, my name is Jeff Bryan, and I'm a clinical pharmacist with the Leukemia Service at MD Anderson Cancer Center. I want to thank you for joining this presentation about a multidisciplinary care approach to managing myelofibrosis. From here, I will refer to this as MF. As we saw in the ET and PV presentation, the treatment of myeloproliferative neoplasms requires that healthcare providers and caregivers from many disciplines work together to address the physical, psychological, social, and spiritual needs of the oncology patient. This model is a good example of a multidisciplinary or collaborative approach in which members from different disciplines with specialized skills and expertise coordinate and communicate a patient's treatment plan, address the patient's physical and psychosocial needs, and ensures the implementation of best practice evidence-based care. This particular model describes the roles of the active caregivers, such as hematologists, oncology nurses, advanced practice providers, and oncology pharmacists. Depending on the need, basic support providers and caregivers may include a psychologist or a chaplain, while community support may consist of advocacy groups or hospital administrative staff, all striving to provide the full continuum of cancer treatment experience. Teams practicing in this way should understand the function and importance of each member's role, increase patient involvement and satisfaction with treatment, and ultimately improve patient outcomes. In some cases, the function of some of the members may overlap. 4 team members on a multidisciplinary team will often have overlapping responsibilities. As shown here, it is not uncommon for the team involved in the daily care of patients with MF and directly involved in the treatment decisions to include the patient and caregivers, a hematologist, and a hematopathologist knowledgeable about MF, as well as a stem cell transplant team, a surgeon or radiation oncologist for patients with refractory splenomegaly as clinically needed, an oncology clinical nurse, an advanced practice provider such as a nurse practitioner or physician assistant, and an oncology-trained pharmacist. The physician and advanced practice providers are both capable of doing a full patient assessment, including a history and physical, while the pharmacist assists the team with monitoring for disease-related complications, response to treatment, drug-related side effects, and encourage the patient to be compliant with the treatment plan. In this setting, a clinical oncology pharmacist is readily available to assist with managing drug therapy side effects and ensure appropriate use of medications and address any clinically significant drug interactions. The oncology clinical nurse is the patient's care planner and the driver of the patient's overall care and helps coordinate the various members of the healthcare team. Since MF can be a very debilitating disease, the primary team may rely on other healthcare providers such as infectious disease team, pain management team, nutritionists, and physical therapists. Given a growing number of clinical trials for this patient population, a research nurse coordinator would be a valuable addition to the team. As noted earlier, it is important for patients with MF to see an experienced hematologist who has a team that is knowledgeable about myeloproliferative neoplasms and the factors that influence a patient's prognosis. In this setting, team members need to be familiar with disease-related characteristics and symptoms and its potential for evolution to acute myeloid leukemia. For patients who suffer from MF, it is especially important for healthcare providers to support and reinforce a lifestyle that will help decrease or prevent the symptoms that impact their quality of life. Hence, the goals of treatment in this setting are to minimize these clinical, physical, and laboratory features that impact their quality of life. As the disease progresses, vigilant monitoring by the team is usually required, as well as recruitment of other healthcare providers as clinically necessary. It is important for multidisciplinary care teams to help the patient understand the full spectrum of the disease. Similarly seen in PV and ET, the MPN landmark survey revealed a discordance between the patient and provider with respect to prognostic assessment and symptoms. In addition, differences were noted between patients' perception of the physician's management and the practices reported by the physician respondents. Larger proportion of physicians recalled asking patients about their most important MF-related symptoms during a symptom assessment, as well as referring to a list of potential symptoms. In contrast, patients often reported less symptoms associated with the disease as compared to physicians' perceptions of their understanding. The perception of patient and physician respondents about treatment needs and goals were generally not well aligned as well. The most important treatment goals for patients in the MF setting was slowed or delayed progression of the condition, whereas symptom improvement was the most important for the physician. And according to researchers, this difference in perception revealed a need for improved patient education to better manage expectations and to help patients set realistic goals. The survey conducted by Mesa and colleagues highlights a disconnect between patients' and physicians' perception of the prognostic assessments, symptoms, treatment needs, and goals. Having said this, the potential benefits of a multidisciplinary care approach for patients with myeloproliferative neoplasms may include narrowing this gap in communication between the physician and patient, which may result in improved patient satisfaction with treatment and hopefully improved survival. With the overlap of responsibilities among healthcare providers, team members provide checks and balances to ensure that services are not unnecessarily duplicated and the interests and rights of all concerned parties are addressed. Lastly, I would like to point out that a multidisciplinary team can improve the mental well-being of healthcare professionals, enhance their professional skills and knowledge, because it provides a setting for learning more about the treatment strategies, resources, and approaches used by various disciplines that may result in increased job satisfaction. In my opinion, the patient should ultimately benefit from this care approach. Thank you for joining this presentation.